Hello. Good afternoon. We're going to ask everyone if they would please take their seats so that we can get started. Oh, that was quick. Shocking. Well, welcome to the Hennepin Health System's annual meeting. My name is Sharon Sells-Belton, and I'm the chair of the board of directors. Over the next hour, we're going to hear from leaders of Hennepin Health System. We're going to see the story of a dad and his daughter who looked to HCMC in a time of great need. And we will also be witness to something very, very special, which will have a big impact on healthcare delivery in the future. So just wait. Before we get started, I want to take a moment to recognize and thank the members of Hennepin Health System's Board of Directors for all that they've done over this past year to help guide and drive the mission of HCMC. They volunteered their time and their talents to our community, and we are forever grateful. We also welcome some new board members to our board this year. And you can see all of their names here on the screen behind me. And I'd like to ask our board members if they would please just stand so that we can give you a round of applause and show our appreciation. I also want to take this opportunity to recognize those who serve on the Hennepin Health Foundation Board, and as well the Minneapolis Medical Research Foundation. These are subsidiaries of Hennepin Health Systems, and they do very, very important work. I'd like to ask those members of the board if they would please now stand up and be recognized by the public. You know, sadly, earlier this month, we lost a valued member of our board with the passing of David Ebel. David was an active HHS board member since 2010. David brought in an incredible wealth of experience to our board from his time as the executive at Dayton-Hudson Corporation, at the Mayo Clinic, at Stanford Hospital and Clinics, and other health systems. I, along with many members of the board and our executive leadership team, valued his advice and counsel and his keen analytical skills that he brought to all of the issues that we considered, especially to that finance committee. And on behalf of our health system community who benefited greatly from his leadership, we want to express our thoughts publicly and send our prayers to his wife Holly and his children and grandchildren as they go through this very, very difficult time. Now, I want to take a moment to recognize one of the founding members of our board who is leaving the board next month. Where is he? There he is. Most of you know Dr. Chris Puto. He is the former dean of the Opus College of Business at the University of St. Thomas, and he has been a very active citizen in the Twin Cities business community since coming to St. Thomas back in 2002 from Georgetown University, where my son just recently graduated. He also has given his time and his talents generously to HHS as a board member since his appointment to his very first board meeting back in July of 2006. He has since served as the vice chair of the board and chair of our finance committee. Chris has brought an unwavering commitment to Hennepin Health Systems and the patients that we serve. His experience and his expertise were critical in the formative years of the board, and as the board matured, his leadership on the finance committee has guided us through many challenges and helped us to build a very solid foundation for future growth. Chris will be leaving us next month to become the 37th president of Spring Hill College in Mobile, Alabama. Chris, I'd like to ask if you would join me on stage. I know you all will join me in thanking Chris for his dedication and commitment. And Chris, I want to give you this to remind you of the many hours that you have devoted to the board of directors.
Thank you, Sharon, and thank all of you. I'll be leaving the Twin Cities with a bit of a heavy heart and yet a lot of excitement because I'm going to be leading my alma mater starting in June. But those of you who are here, I hope you really truly understand the precious, precious treasure that is Hennepin Health Systems and the care that our clinics and hospital and emergency services provide everyone, irrespective of their ability to pay or their need. It doesn't matter. We are saving people's lives every single day, and this is a true treasure. So I've enjoyed being a part of it. I hope you will continue to support it always, forever. Thank you very much.
Thank you. Now, Chris, I want you to know that I went a little bit off script, by inviting you to make some remarks, but I wanted to do that because of the leadership and the commitment to the vision and mission of HCMC and the HHS board. So again, thank you for your service. "2014 was a year of growth for Hennepin Healthcare Systems. You will hear from others today who will talk about how we served patients over the years, and we'll talk about some of the other things that we've done in our new locations, our online, and as well in the homes of the patients that we serve. We will continue to provide relentless focus on patient safety, equality, and stay connected to our community. That is our commitment going forward. And as we focus on moving forward, we will do so with the strong backing and support from Hennepin County. And with that, I'd like to ask Jan Callison, who is the chair of the Hennepin County Board, to please come and address the public and Hennepin Health Systems board members. Jan?
Thank you, Sharon, and good afternoon. It's a pleasure to be here. On behalf of Commissioner Randy Johnson, who serves with me on the Hennepin Healthcare System Board, and the rest of my colleagues on the Hennepin County Board, thank you all for being here today. One of the defining features of our county is strong citizen participation. Hennepin County residents step up and get involved. It is a strength of our county, and we are grateful to the members of the community who offer their service and expertise to the Hennepin Healthcare System Board, the boards of the Hennepin Health Foundation and the Minneapolis Medical Research Foundation, and as volunteers working in the many volunteer roles available at the medical center. The County Board is very proud of this vital healthcare system and the many ways that it has a direct impact on lives in Hennepin County and across the state. Today, you'll hear about the statewide impact of HCMC. From teaching tomorrow's healthcare workers, to providing trauma care, to leading emergency preparedness and managing a poison control system, HCMC plays a critical role in Minnesota's medical infrastructure. As we review our progress in 2014, I want to briefly recognize two strong partnerships between Hennepin County and the Hennepin Healthcare System. First, you may have seen the recent New York Times article that shared with the rest of the nation what we already knew about our innovative Hennepin Health program. It works. Hennepin Health is an integrated healthcare delivery network that blends medical, behavioral health, and social services in a patient-centered care model. The goals are to improve health outcomes, improve customer and staff satisfaction, and reduce average costs per customer by coordinating care and reducing duplication of services. If we do it right, patients avoid inpatient hospitalization, emergency department visits, and other higher cost encounters with the system. The results we have seen are impressive. Medicare costs have fallen on average by 11% per year since 2012 when the pilot program began. The clinical model developed in the HCMC Coordinated Care Center that has also received several national awards, and the strong partnership between HCMC, North Point Health and Wellness, Metropolitan Health Plan, and the Human Services and Public Health Department has improved outcomes and made life better for those who are participating in the program. The second partnership of note involves our own Hennepin County workforce. We know that providing care to commercially insured populations is important to the future of HHS, and employers like Hennepin County are looking for ways to control rising benefit costs. This year, we were pleased to welcome Hennepin Healthcare System and North Point as a new Advantage option for our Hennepin County employees to choose for their health care. HCMC and North Point Advantage offer the lowest premiums and provides access to this outstanding healthcare system. That's a win-win for our employees, county taxpayers, and HCMC, and I am excited to see enrollment growth already in 2015. Advantage members and the rest of our employees also have a new Be Well clinic available as a convenient option. Innovative partnerships with a focus on quality and outcomes leads to success stories like these, and I look forward to more of the same in the years to come. Thank you.
Hello to all of my friends taking part in the Hennepin Healthcare System annual meeting today. I think you know I would much rather be there with you in person. And I actually was just at the Hennepin County Medical Center over at the Poison Control Center. I was so impressed by the work going on there. And as you know from my old job as Hennepin County Attorney, I know a little bit about the work that you do every day. And I'd love to be there right now, but I'm just honored to join you via video. First of all, I'd like to acknowledge your CEO, Dr. John Fryer, and thank all of the staff members, community leaders, businesses, and organizations that work together to help provide health care to the people of Hennepin County and live up to your motto, every life matters. I was excited to see Hennepin County Medical Center featured recently in the New York Times for the work you're doing to provide care more efficiently and effectively. Minnesota has long been a leader in providing cost-effective health care, and it's great to see you being recognized for that. Part of my job in Washington is to make sure we're doing everything we can to keep the people in our country healthy. Throughout debate on the Affordable Care Act, I fought hard to ensure that the law promoted Minnesota's model of health care delivery. You know, we consistently provide higher quality care than most other states, yet our health care providers are reimbursed for their services at a disproportionately low rate. To address this problem, I worked to make sure the law included the Value Index, which rewards high-quality, cost-effective results like we see in Minnesota. And here's some progress to report. Earlier this month, we passed and the President signed into law the bipartisan legislation that permanently changes how doctors are paid for Medicare, ensuring that millions of seniors in Minnesota and across the country can continue to rely on Medicare for their health care needs. This legislation also funds the CHIP program and community health centers. I was so mad about how this was a game of red light, green light every year that actually last year I voted against the temporary fix to show my support for our medical professionals, because I thought that this on-again, off-again way of handling healthcare funding had to end. So you can't believe how happy I was when that bipartisan agreement was negotiated and we got the chance to vote for it and get this done. I know that you're also focused on medical education, and your work in this area benefits the entire state. Last April, legislation I co-sponsored that reauthorized the Children's Hospital Graduate Medical Education Program for 5 years at $300 million a year was signed into law. From your disaster response and medical preparedness work to your level 1 trauma care to your partnerships with rural hospitals, the Hennepin Healthcare System is there when Minnesotans need you most. I'd like to thank you again for the work you do every day to improve health and save lives. So here's a toast to you. You know, we got some budget cuts, so it's Senate water in a plastic cup, but it's the best I can do. Enjoy the rest of the meeting. You deserve it.
Thank you, Commissioner Callison, and thank you, Senator Klobuchar, for your support. 2014 was a great year for Hennepin Healthcare System, or more commonly known as HCMC. I'd like to say that I've been here now a little bit over 2 years. I actually started 2 years ago on April Fool's Day. I'm not sure what the meaning of that was, Sharon, but and last year, so about a month after I came, I was delivering an address to all of you, or many of you who were there. And besides talking about my journey, how I ended up here and how important this place is for me, we talked a little bit about a culture that we needed to grow, one of lean and being efficient and of innovation. And you're going to hear at the end of this talk and later on in the program how important that is, that journey's been. Last year when we were here, we talked about the importance of doing this with our community partners, and that's many of you in this room, and that will always be really key to us. And if you look at our mission statement, we've got the word community in there twice. This year we're going to talk a little bit about how about the impact of Hennepin Healthcare System, not just in Hennepin, but really the fact that this is a statewide and regional impact. So that's going to be the theme of this year's talk. So let's look at the impact that we've had. At the end of last year, 2014, and in January of this year, we went back, the executive team, and we reviewed what we did across the system, in the hospital, in the clinics, in the community, and with our subsidiaries. And we came up with a list of almost 80 very significant, and I'm saying very significant, ways that we improve the care that we deliver to patients, or the work processes that we do each and every day to deliver that care. So lucky for you, I'm not going to go talk about all 80 of those today, but I will give you an overview of what we accomplished and talk about our expanding role as a healthcare provider and partner in downtown Minneapolis. And as a healthcare system, that has an impact, as I said, across the entire state of Minnesota. We saw more patients in our clinics. Clinic volume grew 4% across the system, an increase of 22,000 visits over the year before. We opened the Golden Valley Clinic, our first clinic west of Highway 100. I'm worried I'm going to hit a button here and probably do something I don't want to, so if the slides start going, just let me know. Our clinic locations now extend as far north as Brooklyn Park, east to St. Anthony Village, south to Richfield, and west to Golden Valley. And it's about more than physical locations and hours. Our care is now in the palm of your hand. We introduced e-visits last year so you can get diagnosis and treatment online 7 days a week, wherever you are. As Commissioner Callison noted in 2014, we introduced a market-leading product to Hennepin County. It is a defined network of care for Hennepin County employees provided at HCMC in North Point Health and Wellness. That's our partner. That saves them money on premiums while giving them access to a network of outstanding care. As a partner in supporting a healthy Hennepin County workforce, we expanded our Be Well Clinic for Hennepin County employees and others who work downtown. The Be Well Clinic is a convenience care clinic with integrative health services. That's things like acupuncture and chiropractic, as well as a full-service pharmacy. And now we are working with other downtown corporations, and we'll be announcing more partnerships with downtown employers soon. As East Downtown continues to grow, the new stadium, Wells Fargo, Commons Park, HCMC is growing too. Last year we announced plans for a new clinic and specialty center to be located on 8th Street between Park and Chicago Avenues. We will be consolidating clinics that are today spread across 9 buildings over 5 blocks into a convenient state-of-the-art facility that will provide services into the evening and on weekends to meet the healthcare needs of downtown Minneapolis and the specialty needs of the Twin Cities. I want to recognize our partners in the neighborhood, many of you who are here today, the Elliott Park neighborhood, for their active participation in this process. Our partnership will lead to an outcome that fulfills our project vision statement, building a new window of caring and hope, embracing our diverse cultures and communities, a place of extraordinary care delivered with the view of innovation, compassion, and understanding. Downtown is important to us, but of course we know that the impact of the Hennepin Healthcare System extends beyond downtown Minneapolis. We were Minnesota's first Level 1 trauma center, actually 3rd in the nation, a Level 1 adult and pediatric trauma center. In 2014, we continued to see the toughest trauma cases from across the state. And throughout the year, which marked our 25th anniversary as a Level 1 Trauma Center, we connected with our trauma partner hospitals across the state of Minnesota to thank them for their trust in us and to pledge our continued partnership. When trauma happens, it's that partnership and what happens at the site of the scene that really dictates a lot of what happens afterwards. So this is a true partnership. We serve the state and region with more than trauma care. In 2012, we opened a new center for hyperbaric medicine, thanks to a combination of county, state, and federal funding. Last year, we provided almost 4,000 treatments to patients from across the state and beyond in the hyperbaric chamber. For example, you may have seen the story in the newspaper about the diver from Michigan who was flown here for an emergency treatment. He and our HBO staff completed a dive that lasted 53 hours that led to a successful outcome for the patient. Nurse Kimberly Nerling was the nurse who stayed with this patient for that entire dive. Can you imagine her calling up at home, honey, I'm not going to be home for dinner tonight? And she grabbed her school books because she was taking some advanced classes and took them on the dive with her for 53 hours. That is what you get when you combine state-of-the-art facilities and unparalleled staff dedication. And that kind of commitment to our patients is demonstrated by our staff of more than 6,000 healthcare professionals each and every day. They are the leaders in their professions, active in their communities, and highly recognized by their peers. Another example of the statewide impact is our Minnesota Poison Control System. We provide public and professional education, prevention services, and public health surveillance. In 2014, the Poison Center answered nearly 50,000 calls from Minnesotans in all 87 counties and operates 24/7, 365. Every dollar spent on the Poison Center saves $13 on unnecessary medical costs and lost productivity because 91% of exposures in the home are safely managed at home through consultation with our poison control specialists. This saved Minnesotans $35 million in health care and lost productivity costs and prevented 27,000 unnecessary emergency department visits just last year alone. But that's just part of the story. As a father, as a grandfather, I can tell you that the real impact of the Poison Center is felt one telephone call at a time, one family at a time, as the story of Ayla, a little girl from way up north near the Canadian border, will show. This is
Poison Control. This is Kurt. Can I help you?
Yes, and my 2-year-old daughter just drank some mineral spirits.
It was literally 20 or 30 seconds.
Ayla, you okay? Ayla, you okay?
A little tiny cap full of mineral spirits. Ayla went on top of the counter and grabbed this cap.
You okay? You okay? You okay? Yeah.
Saw Ayla had the cap in her hand, but she had the mineral spirits in her mouth and had ingested it.
Hey, stay with us, okay? Hey, stay with us, okay?
Worst day of my life.
I got a call sometime in the afternoon from a gentleman stating that they thought their child had ingested some mineral spirits.
As a dad, a scared parent, I was, not in the right mind to think.
I can hear kind of coughing. Are you able to breathe though properly?
Aspiration of hydrocarbons is the leading liquid poisoning killer of children.
When you're holding your child in your arms and their eyes are on the back of their head and they're gagging and gasping and turning blue, I can still picture it today.
Well, just try and keep her as calm as possible.
Okay.
And then offer her something to drink.
As a parent, as an EMS person, and as a certified specialist in poison information, I was extremely concerned, and it really just tugged at the heartstrings. But, maintain there, I realized that I was basically his rock for him at this point in time.
I'll stay on the line until they get there.
Okay.
It was about a 20-minute wait for the ambulance to get to us.
You are thinking it's a very, very long period of time. Please come. Where are the paramedics?
That's what happens when you're living in small-town Minnesota, in rural Minnesota.
Inflammation, coughing, pulmonary edema, and even respiratory failure. So treatment's pretty much supportive.
There was multiple other phone calls going on simultaneously to the ER doc, to the ambulance.
Please help me. I'll do anything you tell me to do. I know you guys are the experts. And in this case, that's how that clinician was at the initial hospital.
You need resources like the Poison Center. They're a phone call away. They're 7 hours away drive, but they're a phone call away.
Poison control, this is Kurt, can I help you?
Minnesotans call about 48,000 times each year. All 87 counties utilize the Poison Center.
Instead of being an allergic reaction or a chemical sensitivity, it might be a direct effect of the chemicals.
91% of the time, patients that start in the home, we can keep at home. And we do that by providing medical assessment, treatment, and then follow-up calls to make sure the patient does well.
In these situations, you can't think straight. You can't think of what's the best thing to do. You need someone else to guide you and direct you.
It's not a service that you can just type in a question and get an answer back, say, on the internet. For every dollar spent on poison control services, there's over $13 saved of unnecessary healthcare costs and lost productivity.
Hey, Kurt.
Welcome.
Kurt,
Good to meet
very
you.
nice to meet you.
Yeah.
Appreciate it.
Oh, absolutely.
I've never met such a caring staff before. They're just awesome.
You know, I was just doing my job, but that personal connection there really brings it home. It was very, very satisfying, a little tearful, and just to see her running around happy. And
Yeah, do you remember when you drank that yucky stuff?
Yeah.
Yeah, you remember that?
Yeah.
Yeah. Kirk helped us when you drank that yucky stuff.
this all worked out well. The system worked, everything worked, everybody's happy, and I got to meet her a year later, and it was, and the family, just an awesome family.
Every day, they're just doing amazing work for every community in the state. Our family speaks for every family that's had to call the Poison Center. Every family is so thankful that we have this resource and these people in a phone call away.
What a touching story. We're working with the legislature right now to ensure the state adequately funds its statewide resource. I have to say that it's actually truly a national treasure, and they do a tremendous amount of research that really has a nationwide impact, and this is a center that should make everybody in this room proud. On review, we had many successes in 2014, and it appears that we are well on our way to a successful 2015. We are proud of Hennepin Healthcare System, and we are proud of Hennepin in our name. We appreciate our partnership with and support of Hennepin County. Can you hear that, Jan and Randy? But as you see, our success and impact go way beyond Hennepin County and even beyond our state. Another part of our mission that also illustrates our reach is excellent education programs. And I'd like to invite Dr. Michael Belzer, our medical director, to talk about our medical education program.
I'm not the innovation person, I'm the old guy, but yeah, thank you. So statewide impact is the theme, and I want to talk about teaching and training the Minnesota healthcare workforce. So founded in 1887, we were initially known as Minneapolis City Hospital, later Minneapolis General Hospital, and finally Hennepin County Medical Center. Although named for our city and our county, we could have easily been called Upper Midwest Medical Center or Minnesota Medical Center. The Hennepin County Medical Center footprint covers more than the metropolitan area for sure, and the entire state has benefited from our educational efforts, workforce training relationship, work with the university, and our statewide advocacy efforts focused on trauma healthcare policy for the underserved and on medical education. So how so? Each year, Hennepin County Medical Center trains more than 20,000 healthcare providers on our campus through online training and across the state through our outreach training programs. Wherever you live in Minnesota, the many volunteer firefighters, police officers, sheriff deputies, paramedics, EMTs who respond when you dial 911 likely receive some or all of their training from us. Our emergency and critical care education staff provide instruction for more than 10,000 student visits and more than 81,000 hours of student instruction in courses taught on-site at Hennepin County Medical Center and off-site in diverse settings in Minnesota and online. Community physicians and many other practitioners, from nurses to dentists to speech pathologists who work across the state and region, come to Hennepin County Medical Center for continuing education conferences and courses to update their skills and knowledge. Innovation is an educational hallmark of progressive organizations, and after much hard work at the state legislature and utilizing our influence with U.S. congresspersons at the federal level, we were able to raise the necessary millions of dollars of capital to design and build our simulation center. 2 years ago, we opened the ISIC, which is the Interdisciplinary Simulation and Education Center, where we provide innovative simulation training for Hennepin County-based resident physicians and medical students, as well as for practicing physicians, nurses, pre-hospital providers, and other allied health professionals from across the entire state. We are able to create care settings with our high-fidelity simulation rooms that enable a broad spectrum of simulation training for surgical procedures, medical interviewing, intensive care unit management, and resuscitation at all levels. In addition to the statewide use of our Sim Center, we also extend our educational efforts through web training to thousands of practitioners around the entire globe. We anticipated the high demand for the Simulation Center facility, and we included additional rooms in the construction to build out, and with future philanthropic partners, we look forward to 2 more observation rooms. With support from those who share our commitment in education excellence. University of Minnesota. Well, traditionally, the public hospital has been the medical education leaders in the United States, and from the beginnings, our beginnings more than 100 years ago, we've always had a very special relationship with the University of Minnesota. Very few knew this, but the first buildings of the original University of Minnesota Medical School in the late 1880s were located immediately across the street from Minneapolis City Hospital. By 1908, there were 12 interns working at the City Hospital, and the official relationship with the university was cemented in 1909 when the superintendent of the City Hospital, the Hennepin County Medical Center, preferentially assigned University of Minnesota faculty as attending physicians during the winter months to increase the patient base for the university's teaching service. The internship, first year of residency, later became a requirement for the Doctor of Medicine degree at the University of Minnesota in 1911, and with this official act, the University of Minnesota became the very first medical school in the United States to require an intern year prior to granting of a degree. By 1920s, the City Hospital achieved a national reputation not only for quality of care, but for the high quality of medical education, and in 1924, there were 39 members of the resident staff, none of whom were paid. It was that same year that the privilege of serving as an intern at Minneapolis City Hospital was officially extended to female medical students. To give you an idea of the scope of training efforts with the University of Minnesota, last year Hennepin County Medical Center trained 364 medical students from the university who completed rotations in, for example, emergency medicine, OBGYN, gastroenterology, medicine, surgery, urology, and a dozen other specialties. We've trained 890 resident physicians, including Hennepin County Medical Center-based residencies, rotating residents from the University of Regents Hospital, Hennepin County Medical Center, Medical Examiner's Office, and the Mayo Graduate School of Medical Education. And not to lose sight of our own programs, separate from the University of Minnesota, we train over 235 resident physicians each year in 14 of our own residencies based at Hennepin County Medical Center, and most of our trainees go on to practice in Minnesota. Advocacy with our legislators is a statewide effort as well. We strive to be very active in the state, both for workforce development support of medical education and legislative support for healthcare funding for the underserved. Many of our medical leaders and our governmental affairs folks spend considerable time working with our state legislature to benefit the entire state. In 2014, this last year, Dr. Pryor served on the Governor's Blue Ribbon Panel Commission on the University of Minnesota, and I am the vice chair of the state's Medical Education Research Costs Committee, mandated by the state legislature that distributes $56 million to training sites across the state for training medical professionals. Many of my colleagues and I helped advise the Minnesota Legislative Healthcare Workforce Council that was asked to identify current anticipated healthcare needs for the state, and the work product from that commission includes several bills that are presently moving through the state legislature, including increased funding for primary care residencies, increased stipend for mental health workers, advanced practice providers, and the important role for supporting loan forgiveness programs for physicians in Greater Minnesota. Additionally, state legislators have relied on testimony and support from a number of our faculty in areas of Medicaid expansion, traumatic brain injury, elimination of healthcare disparities, and novel health delivery programs like Hennepin Healthcare. So as you can see, our legislative efforts certainly extend well beyond the metropolitan area. And in closing, we'd like to say there's no limit in how far you can go with the training you receive at Hennepin County Medical Center. In a little less than a month, a young man who completed our emergency medicine residency program will prove my point. Dr. Shel Lindgren finished the emergency medicine training program in 2005. From his training here, he went on to continued training, including aerospace medicine, and today he's a crew member of the Soyuz spacecraft that will fly from Kazakhstan to the International Space Station in late May, where he will remain until November. And Dr. Lindgren has said on multiple occasions that he received, the education and training he received here provided him with a suite of skills that he uses today. And another sign of the impact of our program is that he invited one of his mentors, one of our board members, Dr. Doug Brunette, an emergency medicine physician at Hennepin as well as on the HHS board, to travel to Kazakhstan to witness the launch. So while we've talked about our statewide impact of our work today, we really should be describing the truly galactic impact of what we do at Hennepin County Medical Center. Thank you.
You know, Dr. Belzer has had over 30 years of executive leadership at HCMC, and he's retiring at the end of this year, and has really been, I would say, a force, as you can see, in the area of education. It really gives him passion and energy, and you've really helped shape this, and you've shaped the successors that will follow you, Nick. So can I please have another round of applause for him? So we had a successful 2014 because we focused on what needed to be done. We continued to improve our processes using lean management system to remove waste from our system and think about efficiency every single day. We saw a financial turnaround of more than $30 million between 2013 to 2014. As much as I'd like to credit this to Larry, Larry and I both know that really this was a team effort with 6,000 team members who participated in this. And we focused on innovation, applying brand new thinking to our people, processes, and structure. We started planning for our new Center for Healthcare Innovation, where we will reimagine and transform healthcare within Hennepin County and beyond, with a focus on innovations that align with our mission of providing patient-centered care, improving quality and safety, enhancing health outcomes, and reducing healthcare expense. We became one of 4 pillars of Treehouse Health, a post-startup healthcare incubator to encourage partnerships with entrepreneurs in healthcare innovation. We believe in continuous improvement, and we are always asking, how can we make it better? I think my executive team, Suzanne and others would say this, we do this every single day, ask how can we always make it better, no matter how good we are. How can we make our service delivery better, and how can we provide better care? Last year, we started a conversation with United Health Foundation about how we could redesign the care model for patients with complex socioeconomic and health issues that includes at least one mental health diagnosis. They saw that the work that we had done with the Coordinated Care Center and agreed to help. To do that, we need to understand what gets in the way of these patients from receiving care in our clinics, and then design a model of care that works for them, not for us. We are in a position to best do that, but this work takes resources and partnership, and we looked in that partnership to United Healthcare. So I'd like to invite Mr. Brett Edelson, the Vice President, United Healthcare, to the stage to tell the rest of the story. I'd also like to ask Mr. David Orbuck, Senior VP for Optum Health, Suzanne Bejan, President of the Hennepin Health Foundation, Dr. Chip Truitt, our Chief Innovation Officer, Dr. Bill Walsh, Deputy Chief Innovation Officer, and Susan Jepson, Vice President of the Center for Healthcare Innovation, to come up as well. Brett?
Thank you.
Thank you very much.
All right. This is the big news. Are you ready? All right. Sure. Well, no. Yeah. That's the big news. So I'm Brett Edelson. I'm representing the United Health Foundation today, and I'm thrilled to be here. Thank you so much for an opportunity to tell you a little bit about this new partnership that we're going to be launching. As many of you know, Minnesota is our home. We have more than 10,000 employees spanning the state from Duluth to Mankato to certainly here in the Twin Cities, and we're proud to call themselves Minnesotans and proud to work for United Health Group. And one of the reasons we're so proud is because we invest to help build healthier communities where we live and where we work. Today, we're here to announce one of those investments right here in our own backyard, a $2.5 million grant to Hennepin County Medical Center to expand upon successful patient-centered team-based care to serve high-risk Medicaid beneficiaries who have at least one severe behavioral health diagnosis like depression. That's a long way of saying that we're going to build on what works to give more comprehensive, more effective care to the people that need it most. We're excited about this grant for a number of reasons. First, as I said, it's right here in Minnesota, and what's not to love about that? And it'll benefit our neighbors right here in the Twin Cities first. Second, this gets at the heart of helping the underserved communities. Third, they're going to engage in the community in this project and identifying the challenges and the best ways to address them. Collaboration is the key to big ideas. We all know that to accomplish big things, it requires many partners working together toward common goals, and we have that intrinsic with this project. HCMC is closely working with community partners to identify ways its services can more actively be involved to improve health. For example, through meetings with community organizations and neighborhood members, several groups are already in the process of defining how HCMC can help meet the healthcare goals of a suburban community. And this grant will make more work like this possible. And finally, they're going to build on this by evaluating this pilot and figure out how it can be replicated. So the potential of this project extends far beyond the Twin Cities or even Minnesota. It may not be galactic, but it could benefit Medicaid beneficiaries across the nation. We're so pleased to play a part in bringing these partners together to make a big impact on how healthcare is delivered. So a little bit of background. This grant is part of the United Health Foundation's Helping to Build Healthier Communities program, which provides critical resources to nonprofit community-based organizations like HCMC across the country to improve communities' health and well-being. Since it was established by United Health Group in 1999, the United Health Foundation has committed more than $285 million to programs in communities worldwide to improve our health system, build a diverse health workforce, and enhance the well-being of local communities. As a company and as individuals, we're always looking for new ways and new partners to improve health and healthcare for those we serve. So, on behalf of the United Health Foundation, I just happened to pull some of that. United Health Foundation, United Healthcare, Optum, and our 10,000 Minnesota employees, congratulations for helping to make healthcare better. We just mailed this in, right? Yeah.
Yeah, one more thing.
Anything for Angela? Thank you so much. Thank you. We're excited about what we're going to do together.
Thank you, Brett. Thank you, team. Thanks to all of you. It really does take teamwork. That's one of our values, and we really live that, and I think this just really demonstrates that. So thank you, United Healthcare, and thank all of you for attending this afternoon. 2014, as I said, was a very successful year, and 2015 is going to be even better because of you. So I hope you'll stay with us to celebrate this achievement and to get to know each other. And this reception is sponsored by the Hennepin Health Foundation just outside this auditorium. Thanks a lot.